It's just a headache. Oh, God.
Dad, you're bleeding.
You're not getting in here.
Jeez, can I talk to you outside for a second?
Why don't you just tell him the truth? How did your first plan work out?
Permission granted.
Telling the truth wins! Is this the day the house was finally pulled back from the dark side? Very excited to be reacting to House MD Season 7, Episode 7, A Pox on Our House. On this channel, we're reacting to all 177 House episodes, and this will be episode 139. Let's see if I can get the diagnosis before House does as a doctor working in London.
Shouldn't they be up by now? I'm happy to kill my daughter, but I feel a little awkward about killing your son.
Help! Shark!
How cool is this? Can I see? Ow!
What was in that jar?
16-year-old girl. High fever, vomiting, bloodshot eyes. She was scuba diving on the wreck of a Dutch slave ship.
The virus can't survive over 200 years.
You have. Isolate, get baseline blood draws for smallpox antibodies, and vaccinate the entire family.
What do you think I have?
It's really not worth going into because the odds are astronomical.
Smallpox.
Smallpox?
Did you have a case? Don't worry about it.
I think she knows that I faked a lab test and lied to her to save my last patient.
Would you ever be extra nice to a theoretical boyfriend if you were really mad at him?
Negative for varicella and measles, so all of our ideas are off the table.
Antibodies could be in the joints.
You know.
Of course I know.
I can't apologize if I haven't done anything wrong.
You lied to my face.
To do my job.
This house cuddy romance seems like it's on a timer set for fireworks, the type that explode prematurely and rip a hole in your roof. Our patient definitely wasn't expecting her 200-year-old cesspit of a jar to explode in her hands though, and what a storyline this is to diagnose. On a side note, the production and storytelling here is just a chef's kiss of perfection. So what's in our diagnostic recipe today? We've got a tablespoon of fever, a dash of vomiting, and a sprinkle of bloodshot eyes. If we look a bit more closely to the patients that were on the ship though, they may not have had smallpox. In fact, how did they know what they had? Doctors back then didn't exactly have specialist mobile tests, and it's tough to confirm when most of the evidence was destroyed via cannon blasts. House is thinking that the antibodies could have somehow been pushed into the joints via the scuba diving pressure, but that's definitely not a thing. Even if it was, then as she's still sick, the antibodies would be in constant production, so new ones would be spilling into the blood all the time. Looking at the patients who were on the ship, my initial thought was that it could be leprosy based on how it looked. That doesn't fit though, as it would need to be able to survive outside the body for 200 years in a jar, which would not be possible. In all fairness, that jar did look like it had some kind of soil in it. Thinking about what could survive that long and be highly contagious, oh, this is a good one. Anthrax. Usually it causes a singular boil at the site of exposure, but it might be hidden or it be too early for that to show. So it can begin with a flu-like illness and then sore throat, fever, fatigue, and muscle aches. If it is that, then within just a week she'll have severe respiratory difficulties, and if she's not treated, then the mortality would be close to 100%. It can also form spores and survive fairly easily for decades, as it did in the soil in Gruinard Island from World War II to the late 90s. It was actually only until an activist group called the Dark Harvest Commandos sent the contaminated soil to the place who developed the bioweapon that the government started a cleanup effort of the island. Oh, okay, I like this. It would be quite unusual, but I'm gonna have to go for anthrax as my first diagnostic guess. Let's get more clues.
You don't get to lie to me about anything. I can't compartmentalize my life like that.
What is it?
I think you do have smallpox.
Bottom line, it's 30% fatal.
There's a rash under your daughter's arm.
Like more of those gross bumps?
It's just not smallpox.
All hospital entrances and exits will be restricted until further notice.
I'm Dr. Broda, head of infection control, CDC.
It's just not smallpox.
We're going to airlift blood and tissue samples to Atlanta. We'll have the DNA results in 18 hours.
What looks like smallpox, but isn't smallpox?
It's the captain's log from the Sotas Oezlerzoom.
It's the middle of the night in the Netherlands. Nobody's working.
I want you to translate something for me.
For why you want I translate? Shaking and red eyes? Oh, also African men make go in his pants. Say only African men sick.
We're looking for a disease that discriminates.
Captain and crew got clean drinking water. Slaves drank whatever they could. Scrofula.
We need to test for TB.
There's no way the CDC is going to give us access.
We think it's meningococcal disease.
Are you feeling all right in there?
It's just a headache. Oh, God.
Dad, you're bleeding.
You're not getting in here.
Jeez. Can I talk to you outside for a second?
Why don't you just tell him the truth? How did your first plan work out?
Permission granted.
Telling the truth wins! Is this the day the house was finally pulled back from the dark side? Speaking of which, it seems like we have a couple of very spicy clues coming in, including a possible implication of the Black Plague. Why? Well, that classically does also start with fever and feeling generally unwell, but also can cause abnormal rashes in the armpits that then develop into big black buboes. The rash on the side of the knee itself looks relatively nondescript. If I saw that in clinic, I'd say it looks like small blisters with some of them joining together, which we call confluence. They also seem to be fluid filled, so I'd initially say shingles, but the armpit involvement makes that basically impossible. Shingles is interesting like that because it's the reactivation of the chickenpox virus that hides in a nerve for many years and then comes back in that restricted area. Armpit involvement means no restriction. No restriction, no shingles. Anthrax is still on this forbidden menu though, as would be Clostridium botulinum, also called botulism, since that can survive for centuries as well. Oh, what's interesting is the fact that the jar was shut. That means whatever pathogen doesn't need oxygen for survival, which means it must be anaerobic if it actually is a bacteria. Both anthrax and botulism are caused by anaerobic organisms as well, but botulism symptoms don't really match here. Why? Well, because typically they cause a dry mouth, blurred vision, constipation, and progressive muscle weakness and paralysis, which she doesn't really seem to have. Most of the time, it also doesn't really do anything to the skin. If I got it already with anthrax because of the Gruinard Island reference, that would be insane. I bet it's that. If it is, then they should be glad they've shut off the hospital because it's a bioweapon for a reason. It does also explain why the dad is unwell now with what may just possibly be more than a headache. I also love how House now needs to leave the room every time he has a scheme in case Masters decides to foil their sneaky plans. So much scandal. But based on just the way it's changing clinically, I'm gonna have to go with Yersinia pestis or the Black Plague as my second diagnostic guess. Some bits don't fit, but it could work. All right. Let's get more clues.
After she gets denied, do the bait and switch.
Broda agreed to CT the dad's brain.
Good work.
He's just developed pustules. He's now too dangerous to transport.
He's got full-blown smallpox.
We have our diagnosis. If you're eager, you can go find us a new case.
I just want to look at the rash under her arm to see if it's matured.
You can look through the glass.
The soles of your feet. There aren't any lesions.
This isn't Lemmy.
Julie doesn't have smallpox.
The dad does have pustules there. How does he get smallpox but skips her? We gave it to him. Dad had kidney cancer.
6 years ago, he's been in remission.
Well, it's obviously back. Shot his immune system. Smallpox was causing the kidney failure. The blood would be brown. It's red.
You're insane!
But I'm right.
I hope you are. Because I can't let you out now.
Put the suit on.
It's unnecessary, Mom.
I'm getting worse, aren't I?
Interferon takes a little time to work.
Oh, we're getting close to the end of this series, and House is definitely upping the ante on how to make a dramatic exit. That unnecessary suit is starting to look a little bit more fashionable. Well, as fashionable as an oversized orange onesie can be. So the father is immunosuppressed. Their smallpox vaccine gave him the disease, which is possible as it is a live vaccine. And now we still have no idea what the girl has. Or well, the team has no idea. I would have her doing star jumps, of course, by treating her anthrax with intravenous antibiotics. Interestingly though, she'd probably still be in hospital, as some anthrax episodes need 60 days of antibiotics, most of which needs to be in the vein. We can do in the vein antibiotics at home though, as long as the regimen isn't like 4 times a day, or we're worried something else will get injected into the line, which does actually happen. We don't have any major new clues here though as to what's going on, aside from the father being a false alarm. So what do we actually know about smallpox? Well, it was a contagious, deadly disease until we figured out how to protect from it with vaccines and eradicated it in 1979. It was so aggressive that 50% of the people who contracted it actually passed away. People had no idea how to prevent it until Edward Jenner, an English physician, realized that milkmaids weren't getting smallpox. Why? They were getting cowpox instead, which provided cross protection. So he then decided to go infect a boy with cowpox, which gave him a mild illness, then try and infect him with smallpox, and nothing happened. That could have been a difficult one to explain if it didn't work. Seems like Edward Jenner is the 18th century Dr. House. Where would we be without all these people taking risks though? Maybe humanity would have been eradicated, or maybe we would have been infected with a super virus that gave us all powers. Nobody can ever know. But what we will know is more clues once we see if the interferon actually works.
Get my team down here.
Your mommy and your Lammy both really need you to get better.
I'll try.
Interferon's not working.
Means this is smallpox.
What else could it be?
This is textbook smallpox.
You screwed up going in there. You should say goodbye to your family.
I love you.
Just hold on.
You gotta take care of my boy.
Dad.
I will always love you, Roger.
Dad.
You're killing me. My air supply's almost out.
Can we go back to the cat? Did the cat get sick?
Gerrit, he died.
Before he died, did he lose his fur?
How did you know?
They do carry rickettsial-pox. Escars appear with rickettsial-pox, but not with smallpox. House, you have to examine the body. Look for escars, hurry.
You really are annoying. Escars.
Start the girl on doxycycline right now.
You're gonna be okay.
Oh, what a spicy episode and interesting diagnosis. I've got to admit, the symmetry between the past and present here shows how similar we already are, no matter how much we try to deny it. The boy in the past losing his father, and one in the present. Ultimately, we all bleed the same. Incredible how Masters came in and saved the day though. She is definitely gunning for House's job. You may be wondering what on earth rickettsial-pox is, and it's a cousin of the bacteria Rickettsia rickettsii, which causes Rocky Mountain spotted fever. I love the story behind this episode, but the thing about rickettsial-pox is that it doesn't really survive well outside the body for a couple of days, never mind 200 years. On the accuracy front, I was hoping they'd at least get that one right here, which is why I went for the anthrax, but it seems like they went with similarity with the rash instead. Very cool story though. 8.3 out of 10 entertainment, 8 out of diagnosis, 6.1 out of 10 accuracy. This episode doesn't make full sense until you watch the previous one where a politician gets a taste of his own medicine. Here.